Prostate cancer is the most commonly diagnosed cancer in men in this country every year and has been for a long time.
Prostate cancer is a adenocarcinoma of the prostate gland. The prostate gland sits between your bladder and your perineum. It's mainly in older gentlemen, usually in their 60s and above, and it's one of the most common cancers in America.
You know, one could make the argument it's almost a natural part of aging. And the difference is trying to figure out which ones are small, won't cause a clinical problem for the patient, and which ones need to be treated.
Prostate cancer is a type of cancer where there is no manifestation of the disease until it's very advanced. So it's very important for patients to get screened so the cancer can be detected early.
With PSA testing, we are able to detect prostate cancer in an early and curable stage for roughly 90% of men so diagnosed.
The majority of prostate cancer is staged based on the PSA. So many men come in for an annual routine screening once a year, have a PSA test, and their PSA test may be elevated.
The stage actually in prostate cancer is based on three factors: what we feel on our physical exam, the PSA level, and the Gleason score. The Gleason score is a score that the pathologist gives to tell us how aggressive the cancer is.
Typically, patients who are in a low-risk category, they have many options available to them.
Those options can be either surgical or external beam radiation therapy, sometimes called IMRT, or seeds, also called brachytherapy, and some newer forms of radiation therapy, such as stereotactic body radiation therapy.
The most common way of delivering radiation therapy is with the external means, and the most sophisticated way of shaping the beam around a target, it's called intensity modulated radiation therapy, or IMRT for short. And this is where beams of radiation are directed at a specific target.
And then the treatments, that typically takes maybe 30 or 40 minutes for the patient, and they're given every day. And a whole course of treatment typically takes about 8 to 8.5 weeks.
I'm usually waiting in the area a couple minutes. I come in, I change, put a gown on, and I get in pretty quickly into my treatments. It takes about 10 to 12 minutes or so. I come out, I dress, I leave. It's pretty straightforward.
The other way of delivering radiation therapy to the prostate is called brachytherapy.
Brachytherapy is a very fancy name, but it simply means putting the radiation next to the cancer.
Instead of coming every day for a number of weeks, it's a short admission to a hospital. It's an outpatient procedure where we implant these small seeds into the prostate. They're about the size of an uncooked grain of rice.
I started to do some research when I did get diagnosed, and first thing I had to determine is what course of treatment I wanted to take. And once I did that, I looked at the recommendations that my doctor gave me, came and met the staff here, and felt very comfortable. I love the fact they took a lot of time to explain all my options to me. Wanted to make sure I was really comfortable with what they're doing, and I certainly liked the fact that it was a fairly new facility and they had the latest technology.
Many of these treatments are going to be equally curative, but where the differences lie are in side effects, complications, toxicities.
The patient has to ask their physician, what is the risk to damage to my bladder, to my urinary function, to my sexual function, and my rectum? In general, the outcomes for early stage prostate cancer are excellent. People don't have to really fear about being cured. A patient does not have to choose what therapy they're going to get based on outcome. What they really need to look at is what side effects do they want to risk.
It's very important for me as the physician to describe each treatment fairly so that the patients can come up with a decision that's going to be best suited for their lifestyle and their desires.
Fortunately, I only have 3 more days to go after today, and it has been an experience, and I would advise everyone to check themselves out. It could save your life.